it going? Oh, sure. Okay. Okay, great. Would you prefer to do? Thank you. I don't know if that's an option. Oh. Woo. That's probably, yeah. I think we could. That's okay. No worries. Thank you so much. I don't want to close the door, but we might have that happen a few more times. Yes. Yes. All right, everybody. Good afternoon. My name is Nancy McBrady, and I'm a Deputy Commissioner at the Maine Department of Agriculture, Conservation, and Forestry, and I am welcoming you all to this session on navigating healthcare insurance. A goal of our department is to help Maine producers access affordable health coverage. We know that many farms and farmers are underinsured, not insured at all, or may have a spouse who works off farm so that the family can receive health insurance coverage. Understanding options can be daunting as well. And there's considerable uncertainty regarding accessible, affordable healthcare insurance in the public marketplace right now. Our goal for this session is to provide key information that will help you better understand your options and ideally assist you, your family, and your employees in finding affordable coverage. Our presenters here today will describe coverage options available through Maine's health insurance marketplace, including eligibility and enrollment specifics for Cover Me plans and MaineCare. They will also provide some real-world examples to demonstrate how the programs work and what they may cost. This is a complex topic, so we are recording this presentation and making the speakers' presentations available. Representatives will also be on hand throughout the show today to speak with you individually and answer some questions that you may have. We also have handouts with important coverage details. Our speakers today will be Hillary Schneider, Director of the Office of Health Insurance Marketplace at the Department of Health and Human Services, Rachel Collimore, our Consumer Assistance Program Manager at Consumers for Affordable Healthcare, and then Philip Doucette, a partner at Austin Associates, an accounting and advisory firm well known to ag producers here in Maine. So without further ado, I welcome Hillary to present her portion of today's conversation.
Thank you. As was stated, I'm Hillary Schneider. I'm the director of the Office of the Health Insurance Marketplace. We do business as coverme.gov. We are an office within the Maine Department of Health and Human Services. I've been in the role for a little over 2 years, and I come from the world of consumer and patient advocacy. And helping consumers in the access to care space for more than 20 years in Maine. Next slide. All right, so this is just a slide that shows us a little bit about where coverme.gov fits into the health insurance landscape. I like to say we're often a bridge between different parts of the healthcare system. Before health insurance marketplaces were created under the Affordable Care Act, there was often a gap in coverage where people who are buying insurance on their own, oftentimes it was called the wild, wild west of the health insurance market, where it's really difficult to even know what carriers operated in that market, where you would get information, how to compare plans. It wasn't on an apples-to-apples basis oftentimes, and where you would go to get help. And so we serve kind of filling gaps in coverage. So if people make a little bit more income and they no longer qualify for Maine Care, which largely covers our low-income population in Maine, then they can come to the marketplace, coverme.gov, and see if they can get insurance. And then oftentimes we hear from folks whose spouse or partner turned 65 and they had coverage through them, and so they no longer have coverage because their spouse or partner is on Medicare, and they can come to us, or people who are early retirees. And then if people lose access to job-based coverage, or they don't have access to coverage through their job, people who go and do gig work, go and start their own farm, thank you, people who work for a seasonal employment, small employer, or if their employer no longer offers coverage, they can come to us. And then we bridge those gaps when people lose a job, when they lose job-based coverage, when they move to Maine and are looking for employment or insurance, when they get divorced and lose insurance coverage, or other things like that. So what is coverme.gov? We are a one-stop online platform. I like to say we're like the Expedia or Travelocity of health insurance. You can go. We're primarily an online website where you can compare your options for health insurance. We have an anonymous tool, so if you were looking for coverage and you went directly to the insurance company's websites, oftentimes they make you fill out an account and put in a lot of information about yourself. You can come into our website and all you have to put in is your zip code, the ages of the people who you want covered, and your estimated household income for the year that you want coverage. And then you can see what plans are available to you, and they're compared on an apples-to-apples basis. What your out-of-pocket costs would look like, whether your you can put your health care providers in, and it will show you if they're covered and what those costs would look like. You can put in your any prescription medications you take, your local hospital, and it would tell you whether those things are covered and what it would look like for you for out-of-pocket costs. It is so that is one role that we play is providing that one-stop shop to help you navigate purchasing coverage on your own. The only other role we play is that we're the only place in Maine for Mainers to access financial savings to potentially lower the cost of their monthly premiums, so the monthly amount they pay for insurance. Those are largely in the form of federal tax credits, which are called, if you take them in advance, they're called advanced premium tax credits. There's been a lot of talk in the national media about those. Some people think they're all going away. That is not true. For some people, they are going away, and for everybody who qualifies, will get a lower amount. But 70% of people who have come in to enroll for 2026 still qualify for financial savings. And actually, as of earlier this month, the average per member per month premium for those who qualify for financial savings is less than $200 a month for our plans. The other thing is we have a lot of options for getting help if you get overwhelmed or confused or you have questions about your specific situation. We have free local help from brokers and enrollment assisters, and you can go to coverme.gov/local help, and you can find people in your community who can help you. Who is eligible? These are the primary characteristics of people who are eligible for coverage. You have to live in Maine. You have to be a U.S. citizen or lawfully present, and the lawfully present categories are declining a little bit because of federal rules, but pretty much have to be a U.S. citizen or fall into an eligible citizenship category. Can't be incarcerated, and you can't be eligible for other types of coverage if you want access, by and large, if you want access to those financial savings. Although there are affordability tests for people who have employer-sponsored coverage that is really unaffordable, they should come in and see if they meet the affordability tests to see if they qualify for savings. All of our plans that are sold on coverme.gov, and I'm going to keep saying this, make sure it's coverme.gov, because there are sites that look like us and pretend to be us, but they are not us. So as long as you go to coverme.gov, you're getting everything I'm telling you about. All of our plans are required to have 100% coverage for a set of preventative services. And so those are things like your annual wellness visit, your cancer screenings, and other recommended screenings, including tobacco treatment. Those are all covered 100% with no additional out-of-pocket costs other than your monthly premium. The other thing is all of the plans cover comprehensive benefits. So pretty much everything you could possibly need for traditional health insurance coverage or traditional healthcare services will be covered. These are things like your doctor's visits, your primary care and specialist, urgent care, ER, surgeries, inpatient hospitalization, outpatient hospitalization, mental health, substance use disorder treatment, lab tests, imaging, prescription drugs, pretty much everything that you would traditionally get in a traditional healthcare provider office. The other thing is, in Maine, due to some Maine laws, we have almost every plan we sell in the marketplace has some pre-deductible coverage, and most plans have a lot of pre-deductible coverage, meaning you will get your first primary care visit and your first behavioral health visit at no copay, and then for all plans you get a second or a third with a copay only. And most plans have actually all of their primary care and specialist visits with copay only. In addition, most plans have a lot of pre-deductible prescription drug coverage. So it's really important to look at the details of the plans, and there are ways you can look on the tool to see what is pre-deductible coverage or in the summary of benefits. And then all of our plans also include pediatric dental, and you can also purchase standalone adult dental policies through coverme.gov. These are the two types of financial savings that we offer through coverme.gov. Again, there are premium tax credits. Those lower the monthly premium. Those are just federal tax credits. It's I think the only federal income tax credit you can take in advance. They do get reconciled when you file your income taxes at the end of the year, so it's important that you continue, if you have variable income, update your income throughout the year with us so you make sure you're getting the right amount of tax credit. Again, 7 out of 10 of our members qualify for those tax credits. The other thing is that a smaller set of folks will qualify for cost-sharing reductions, which give you, if you buy a silver plan, which is a moderate deductible plan, a set of Mainers can get savings on out-of-pocket costs like copays and deductibles. And here on the right is a case study of a family of 3 in Caribou, annual household income of $78,500, enrolled in a silver plan. The full cost of their plan would be over $2,000 a month if they were buying outside of the marketplace, but they qualify for those advanced premium tax credits, so they get a savings of over $1,600 a month on their plan, and they end up paying $395 a month to cover their family with a $3,500 individual deductible, and then a larger household deductible. The other thing that I really want to talk to you about is to make sure you're shopping smart and you know what you buy. We hear from people all the time, Consumers for Affordable Healthcare does, the Bureau of Insurance does all the time, especially in this year where the prices are going up and people are really trying to figure out how they can make their monthly budget work. there is no replacement for comprehensive health insurance coverage. I do believe that if every American could afford it, they would be buying it. Nobody chooses not to buy comprehensive health coverage. But a lot of people are really surprised about how affordable that coverage is through us. And so we, as I said, we are the state's official health insurance place for when you're buying coverage on your own. And any plan you purchase through us meets state and federal standards. It is sold by companies that are licensed to do business in Maine. They have an amount of reserve, so they're not going to go under in the middle of the year and end up not being able to help you out. There's no pre-existing condition exclusions, no lifetime limits on coverage. They're not going to turn around and say, oh, we were just kidding, we're really not going to cover that even though it was in your plan document. Again, there are websites that look like ours that are not ours, so make sure it's coverme.gov. And then watch out for companies and salespeople that are not licensed to sell health insurance in Maine. And you may say, how can I figure that out? Well, if it sounds too good to be true, although sometimes people come to our website and think it's too good to be true, but if you're not at coverme.gov and it sounds too good to be true, it likely is too good to be true. If you go online and you search for cheap or affordable health coverage and you fill out an online form, you're going to get calls from people. Oftentimes they're selling you scam plans. And so you just have to really make sure you know what you're buying. And you can go to the Bureau of Insurance and they can tell you whether the company or the salesperson is licensed to do business in Maine. So before you give someone your social security number or you put your credit card information in, if it's not on coverme.gov, or you don't find it through coverme.gov, you might want to check that out. And so here are some tips to shop smart. Be cautious of unsolicited calls, emails, or texts. If you get a text, it's just like anything. If you get that text that says, oh, click here because we can't deliver your mail, or click here because somebody's coming after you with a lawsuit. It's similar to those scams. If you get an unsolicited text that says, hey, I can get you really cheap health insurance. We don't send out unsolicited texts. Be worried about that. Avoid providing any contact information or payment, again, before you check the Maine Bureau of Insurance. We do not ask you for payment before you can finish your application. You can pay immediately when you enroll in coverage. You can go to the health insurance company and pay, but oftentimes the health insurance company is billing you afterward. So if you're being asked to provide payment right away, should be a red flag. If there's any things like this deal is only going to last 24 hours, or you have to act now, or you have to give me your social security number, be wary of those, just like all sorts of scams. Also be wary of having to join as a member, or if they say, well, you can get this great plan if you're an employee of ours, and you're like, hey, I have a different employer. Be wary of that. So here's what some of those plans look like. And some of these plans are, along the left, are real insurance plans. They're just not comprehensive health insurance, and they're not meant to be comprehensive health insurance. So they can be called association health plans. They can be called indemnity plans, critical illness plans, short-term limited duration plans. You can hear them as like cancer plans. Those things, oftentimes if you read the fine print, it will say this is not intended to be comprehensive coverage. Or some of these are filling gaps. Some of these plans are not even legal to be sold in Maine because we have consumer protections and are allowed to protect people from them. But what happens is that they can have pre-existing condition exclusions, so they can only cover healthy people. And what happens with that is if these plans come in the market and only cover healthy people, then it can take the healthy people out of the risk pool for comprehensive coverage, and then CoverMe's premiums would go up. Also, they can end up not covering things, or not cover maternity care, or not cover, put a limit on, we're only going to cover $100 of this illness. And oftentimes people go to Consumers for Affordable Healthcare, which you hear about a little bit more, or the Bureau of Insurance, and say, hey, I really thought this was legit, and now they're not paying for stuff. And so just really make sure you do your homework and you know what you're buying. And here are some examples that the Bureau of Insurance has shared with us. These are real life examples of Mainers who have run into these situations. So a couple of these are, as I said, they're organizations that they're misrepresenting themselves as us. In other words, they called somebody in an unsolicited call or a text. These people did not go on to coverme.gov or work with a licensed enrollment assister or a broker that they found through coverme.gov. And then they found out they had a health event, and then they ended up with somewhere between $5,500 and $265,000 out of pocket because their health insurance company did not cover it. And so, or they didn't cover the preventive services, or, this one denied claim for hearing aids because the company said it was a cosmetic accessory. And so the Bureau, if you do run into situations like this, you should definitely contact the Bureau of Insurance. They have lawyers and others who can help you, or you'll hear about Consumers for Affordable Health Care's help in this area. And they are able to help a lot of consumers where consumers can get premium refunds, but as it says here, these individuals were still responsible for the out-of-pocket costs that weren't covered. So there's two places to enroll in cover, 2 times a year, or really one major time to enroll in coverme.gov. It's right now. Open enrollment started November 1st, and it runs through January 15th, which is this week, 11:59 p.m. on January 15th, and our call center will be open till 10 p.m. that night. And anybody can enroll that's eligible during that time. If you miss and that coverage goes into effect February 1st, the January 15th deadline. And then if you don't enroll by the 15th, you have to qualify for what's called a special enrollment period, which is a traditional kind of life event that you can see up here that would qualify you. The other thing I just want to talk about is all of our bronze plans this year are eligible to get an associated savings account, which is called a health savings account. Why I tell people about this is because if you are just at the threshold where you are not qualifying for premium tax credits, you should look into a health savings account, because these are pre-tax, tax advantage plans that you can contribute to that will lower your aggregated gross income on your income taxes, and so you can contribute, and these can be used to pay for your out-of-pocket health care costs, and so they can lower your income that would then make you eligible to qualify for significant savings. And then you have this account, and it's transferable, moves with you. If you don't spend it on health care costs after you turn 65, there are ways it can act like a additional retirement account, but talk to a tax accountant or a financial advisor for more. Look some stuff up online. As I said, there's many resources to get assistance through us. We have our website. You can go to coverme.gov/local help. We have a consumer assistance center, and the telephone number is right here that you can call. We're open 8 a.m. to 8 p.m. right now, and 10 p.m. Right before on that deadline day. And then I just want to talk briefly about if you have employees, what are your options? So there's also options for you. There's a couple options. You can get a small business healthcare tax credit if you qualify for that. You can see some information of that on the slide, and these slides will be available to you afterwards. Or you can contribute pre-tax dollars and get tax advantage dollars for it's similar to a flexible spending account. It's called a ICRA or a QSERA, depends on, for QSERA you have to have less than 50 employees. The ICRA is for larger employers. And you can go to this link here and see more information about those options. And then this is really the information I wanted to give you all. If you go to coverme.gov and you go to this, the Learn information for small businesses, or if you go on our website and you find, I think it's Learn More and it's for small businesses, you can navigate or put in the search small businesses. We have a whole page that describes the options. And we also have this tool that you can go in and you can put in your census of your employee census, and it will show you what the differences are for you and for your employees. If you offer them a small business plan, you get that tax credit, or if you instead give them amount of money through this healthcare reimbursement account, and then allow them to come and shop for coverage on our marketplace. And you don't have, though, for these plans, open enrollment is pretty much all year round, so you don't have to do this before the 15th of January. So here's a little bit more for employers with more than 50 employees. They can offer these health reimbursements accounts called ICRA. Again, it can be used for medical expenses. It's tax advantage for the employer and the employees, and it does trigger a special enrollment period for the employees to enroll in at any time. So that's important. And then for employers with fewer than 50 employees, there's a similar arrangement called QSARA, and that is also makes them eligible for a special enrollment period. It does lower the financial savings that people can get through CoverMe.gov with QSARAs, and people who get ICRAs actually don't qualify for financial savings, so if you have over 50 employees. And then again, just I really encourage folks to check us out, because you may find that even what you're hearing in the news, that we can get you access to affordable coverage. As I said, 7 out of 10 consumers purchasing through CoverMe.gov are finding savings, and the average savings is $774 per month. And also, if you never know when you could be diagnosed with a health condition, or you can fall and hurt yourself, or and that medical debt is the #1 cause of bankruptcy in this country, so we don't want to leave anybody unprotected and exposed to those financial costs. And then, I don't know if you can. Sorry. I can also just tell you about it if we can't play it. All right, I'll tell you about this story. So this is Lisa. She's one of our consumers. I really think her story resonates with a lot of folks. Lisa worked in the hospitality industry her whole life, never had access to job-based coverage. When she was getting older, she was thinking about, maybe I shouldn't be rolling the dice every year and risking this. Something could happen in life. And then she heard from a friend that they had found affordable coverage through CoverMe.gov, so she checked us out, and she's really surprised to find coverage that could meet her budget, and it was comprehensive coverage. And sure enough, within 2 months, she did have something happen, and she had an urgent healthcare scare. She ended up in the emergency room and was hospitalized for a number of days. She had to go through significant rehab to learn to use her whole body again, and if she had not enrolled in coverage, she said she would have been in hundreds of thousands of dollars of medical debt. And then after she got better, she said that health coverage really stimulated her to be able to just focus on her health and take care of her health. So she dealt with some chronic conditions that she had kind of been ignoring, and she really credits that first step in that health coverage to really changing her life and allowing her to be healthier. So she never thought it was in reach. She was shocked to find out that she could actually afford health coverage every month. And there's a number of ways to follow us. We are on Instagram, Facebook, TikTok, so check us out. And we put consumer tips up on those channels as well. So not just ads, but tips to help you navigate this crazy world of health insurance coverage. I think it is now.
Yeah, round of applause for Hillary. So yeah, I am. Can you guys hear me okay? I'm also a mom of 4, so I can totally ditch the microphone and project my voice very, very far. Do you have my slides? You do, perfect. My name is Rachel Collimore. I am the Consumer Assistance Program Manager at Consumers for Affordable Healthcare. That's quite a mouthful. You don't have to remember it, just call us Cake. We are designated as Maine's Attorney General to help Mainers navigate health insurance. So everything that Hillary just said, I don't need to repeat what she said. We help Mainers navigate marketplace coverage. We help Mainers navigate MaineCare coverage. We help Mainers understand coverage, even if they have employer-sponsored coverage. And we also help with what we call safety net programs, so hospital-free care, sliding scale clinics, dental clinics, prescription assistance. And then we also help with appeals. So when your health insurance company says that they're not going to cover something your doctor thinks you need, you can call Cake and we can give you some pointers or actually engage in some advocacy to help navigate that. That's a quick rundown of our organization and what we do. And I think I already said it in this slide. So what we are not, though, is we are not an insurance company and we are not a government agency. So Hillary talked about Marketplace. MaineCare is public health insurance, eligibility based on several factors. Marketplace is private health insurance, including the premium subsidies she talked about. There are enrollment periods. Free and discounted care is offered through hospital systems. Discounted care is available at clinics statewide, and eligibility is also based on income and other factors. And like I said, we also help with appeals, complaints, and billing issues. I'm going to talk a little bit about what MaineCare is. So MaineCare is Maine's Medicaid program. It provides no or low-cost health coverage for doctor's visits, specialist visits. It sometimes even covers care that's received out of the state if you need, like, what we might call like a super specialist, right? Eligibility does depend on family size, household income, things like tax filing status. It can be really complicated to know who in your household might qualify for MaineCare. So for example, pregnant people and children may be eligible for MaineCare even if other family members like parents or step-parents are on the Marketplace or have employer-sponsored coverage. And unlike Marketplace coverage, you can apply for MaineCare at any time during the year. You apply at mymainconnection.gov or through paper applications that can be emailed or faxed or good old snail mailed. And you can also apply in person at your local Department of Health and Human Service office. Like Hillary mentioned and was mentioned before, you're going to have access to these slides, and all of these hyperlinks will take you to the resources that are mentioned here. Consumers for Affordable Healthcare can assist with MaineCare-related questions by screening people for eligibility, showing you where to apply, even walking you through the application. And we do that either in person in our offices in Augusta, virtually via Zoom, or over the phone if that's the easiest way for you. We also help with completing those annual renewals that once someone is enrolled in MaineCare, they have to reapply or renew for their benefits every year, and we can help people walk through that, which can be a really complicated process. As I said, MaineCare can be really complicated. There are a lot of different categories. So there's the expansion category a lot of people know about, people 21 to 65. But there's also the Children's Health Insurance Program known as CHIP or Cub Care, and the Medicare Savings Program. That is a program that helps people who have Medicare, and it helps them pay for their Part B premiums and some out-of-pocket costs depending on their eligibility. Our main enrollment assisters understand Marketplace coverage, right? So all the stuff that Hillary talked about, and we can see if you or other family members qualify for those premium subsidies. We can see if you qualify for a special enrollment period, help you complete and submit an application for coverage at coverme.gov, walk you through that really amazing plan compare tool that Hillary mentioned so that you find the right plan for you. You're not just shopping based on your premiums. You want to make sure that your doctors and your hospitals and your prescriptions are covered. Otherwise, you're not going to get a really good return on investment for those premium payments you're making. We can, as Hillary mentioned, the affordability test for employer-sponsored coverage, we can help you navigate that. And if you are offered assistance paying for marketplace plans by your employer, so those QSARAs or ICRAs, we can help you navigate using those and applying for the marketplace coverage, without by avoiding any maybe tax liability issues, because those can be a little bit complicated at times. So we can help you, like I said, complete an application, walk you through that plan compare tool. Just a little visual of all the different plans that, or all the different carriers that are offered. Big names. Anthem, Harvard Pilgrim, Community Health Options. A newer one, Mending, used to be called Taro. They really focus on direct primary care usage and helping support people who use that as their way to get preventative, office visits. So, Hillary, did you mention plan levels? Okay, so some healthcare 101. There are different plan levels. Hillary mentioned the silver plans where you can get cost sharing reductions, but there are catastrophic plans, bronze plans, gold plans, and platinum plans. And the big thing to remember about these is the higher the metal level, generally the higher your premiums, but the lower some of your out-of-pocket costs will be. And depending on the type of health care you typically need over the course of a year, or you're anticipating in the coming year, is a really big factor in what metal level you might choose. We, even if you already have health coverage, we are really interested in educating people about how to use their coverage. So the first barrier is getting you covered, right? And the second barrier is making sure you know how to use that coverage. And we can help you understand what your premiums are, when you have to pay them, what happens if you miss one. We can help you understand deductibles, what kind of care will go to your deductible first. Plans, some plans are tiered, so understanding preferred network, second tier, out-of-network coverage, understanding those out-of-pocket limits, right? What happens, what might lead you to reaching that out-of-pocket limit, and what happens once you hit it. And my favorite, co-insurance. Raise your hand if you know what co-insurance is. If you do know what it is, you've probably already hit a deductible. And then those co-pays and how prescriptions are covered. Prescriptions can be another really complicated thing to navigate, especially if you have some complex medical needs and you need some higher tier drugs. Things like that can get kind of confusing. So talking a little bit about hospital-free care. Hospital-free care covers medically necessary care provided by any Maine hospital and its affiliated practices. So that means emergency room services, prescription drugs, physician services. So if you see a primary care physician who is associated with Maine Health and you have been approved for hospital free care through Maine Health, your co-pays when you see your physician will be covered by hospital free care. Lab services, urgent care services, and other services provided as part of a hospital. Eligibility is based on income. And you must have a medical bill from the hospital or its affiliated practices to apply. And you can have health insurance and hospital free care. So if you are applying for coverage through coverme.gov and you've made the tough decision to maybe downgrade from a silver plan to a bronze plan because the bronze plan premiums are more affordable, and you're really worried about some of those deductibles, we can help you apply for hospital free care and help you avoid some of those costs. If you need assistance applying for them, you can contact the hospitals directly or you can contact us. The hospital free care applications can be pretty complicated, a little more complicated than applying for other programs, so we're more than happy to extend our services and help you make sure that you apply, without any errors that can slow down, the help you need paying your bills. The other thing that's great is there are discounted care clinics. They are all across the state. So if you happen to be uninsured or underinsured, these are a really great way to access the care you need. So they provide full primary and preventative care. Most of them provide dental care. And sometimes they only provide dental care if you are a patient there, which can be really great because dental care can be hard to find. Some offer free services, but they may have very limited hours and eligibility. They are open to everyone regardless of insurance status or ability to pay. And then the free scale option or sliding fee scale options for low income patients. You can call us for more information. I should have probably put the Maine Primary Care Association website up there too. They are a great resource for finding one in your area. Other great thing about sliding scale and discounted care at these federally qualified health centers is that sometimes they provide really necessary health coverage in what might otherwise be a healthcare desert. So you can see on the map, they're located in some pretty rural areas, which can be really helpful for people because we know that transportation is always an issue in Maine. Even if you've got a car, sometimes the roads don't really want you on them. So always a great thing to have. Private insurance appeals. So there are a number of reasons why your health insurance might deny care. It could be a prior authorization issue. It could be a discrepancy between the medical guidelines and your doctor's notes, which means that the insurance company doesn't consider it medically necessary. Network issues. I always say when it comes to appeals, we don't want to overpromise and underdeliver. These are always really complicated. Each appeal, is different. But what we can do is we can give you instructions on the appeals process and the timeframes, which is really, really important. You don't want the window to close. Help you carry out a first level appeal. Then there's a second level appeal, and then there is external review. We can also help you with filing a complaint with appropriate agencies. So like Hillary had mentioned, the Bureau of Insurance. If there's an example where it looks like your insurance carrier hasn't followed the rules, we can help you file that complaint. And then with some degrees of success, we can help you with navigating provider billing departments to resolve billing issues. So there are a lot of things Kate can do, and I've just kind of touched the tip of the iceberg. But there are things we don't do. We do not help with traditional Medicare except for helping people apply for the Medicare Savings Program. So if you are looking for assistance with traditional Medicare or Medicare Advantage plans, reaching out to your local area agency on aging is going to be your best bet. And if you need help applying for long-term Maine care, you're going to want to reach out to the long-term care unit at the Department of Health and Human Services. Here's the number and a link to their website. They can help you do that. I always say, so sometimes when we're really busy, I'm on the helpline and I talk to a consumer and I do an eligibility screening and I play what I call the game of Plinko, right, where they give me their health insurance story and I drop their token at the top and it bounces off the pins and I figure out which bucket they land in. And at the end of the call, I always say the same thing. There is no pop quiz. You do not need to remember everything I told you. The only thing you need to remember is our phone number, because there's no way that we expect every Mainer to know how complicated it is. We just expect them to know our number because we'll help them. And if we can't help them, we will find someone who can. So you can reach us through our helpline. So that is Monday through Friday with the exception of federal holidays. And we are open 8:30 a.m. to 4 p.m. You can send us an email at help@mainecake.org or going to our website and filling out the fillable form on our website. I didn't create a slide for it, but I should have. We are always looking for stories. So if someone has, an example of, a struggle that maybe Consumers for Affordable Healthcare help them through, those stories help to elevate the work that we do. So really encourage people to reach out to us if they have a story they want to share. And the same goes for Cover Me too. The work we do really depends on people talking about how important it was to them that they accessed, these programs so that they could stay healthy. And data and numbers, people kind of blank out, but when they hear a good story like Lisa's story, that helps to remind them just how important it is and that you never know when you're going to need health insurance coverage. So that is the end of my presentation, and I'm going to pass it over to the tax expert.
Good afternoon. Look for these slides here. First of all, I'll just say Rachel and Hillary provide great services, and they're really great resources. I think Rachel's point of giving them a call is a big thing, because years ago when this whole idea of, you know, advanced premium tax credits and all these things, there wasn't really good resources back then. It was, as Hillary mentioned, the wild, wild west, and it was a little bit, there wasn't good education of the people signing up for health insurance. And so they'd end up in situations, oftentimes I was the deliverer of bad news, saying, oh, that's cool, you got this really good advance on this tax credit. Well, here's what the advance part means and how it's going to get trued up now. So that's what I'll talk about some. I'm going to basically expand on some of the numbers pieces of what Hillary spoke about earlier. For one, premium tax credits, they are a tax credit that you get in advance, long in advance of when it's going to be trued up on your tax return. So based on what you have for criteria and information when you sign up, will determine what your advance tax credit is. And when you get to the end of the year and you file your taxes, you know, it's a bit like a game show. If you were right on, then great, you're probably fine. If you underestimated your income, then you may get a little more tax credit than you expected. And if you overestimated your income, whichever way, if you made more than you told them you'd make, if you made more than that, you may have to repay some of your credit. If you didn't make as much as you told them you'd make, you may get a little more credit. And that's going to change significantly for 26, which I'll get into. But I think one thing that doesn't happen enough, and you guys can maybe attest to this too, is people sign up for health insurance now, you know, December, January, November, whenever. And I don't think it happens often enough where they have a significant change in income or a life change and they go back to, you know, where they started and said, hey, by the way, I just got, you know, my spouse just took on a new job and they doubled their salary, or I just lost my job and their income changed a lot, because that can happen, certainly can happen. And if that happens, you can change your plan and your credit will change along the way. If you don't do that, it may, depending on what changed, it may work out better or worse for you. But that's important to do. I don't think enough people do that along the way. Some changes for this year, and I'll kind of get into these later, but there were some caps on if you had to repay some of your credit. You were often limited in what you had to repay, which could work out for people. That is changing this year. Higher premiums are expected. Some info on that here. Insurer filings proposing a median 18% rate increase for 26, and what you'll need to contribute for the benchmark plans is increased as well. That's a lot of the reason why you hear them talking about when it was during the government shutdown and these healthcare subsidies they were fighting about. This is what that was. The subsidies aren't going away. They've been around for a long time. During COVID, they changed a lot where they expanded and included more people, and it reduced what people had to contribute to the plan and allowed more people to receive advanced credits that weren't allowed to get it before. Those temporary expansion of those credits is what's ending, is what has now ended. And there is right now, as we speak, you know, the House just approved a bill a couple days ago that could potentially bring them back for a few years. It's going to the Senate. I don't know what chance it has of passing there. I wouldn't really rely on it, but it affects a lot of people. I got a lot of clients that are right in that kind of sweet spot or sour spot, I guess it could be, where they've been able to get credits for the last handful of years, and now, as it is right now, they can't. So they could pay a lot more in health insurance going forward. And here's a chart that kind of shows that. I think the most important part of this chart is this arrow at the end here, because that means the bottom line is where it's been the last 5 years. This is how much people had to contribute and who was able to get a credit in relation to where they are in the federal poverty level. As you can see, if you were over 400%, you could still get a credit. But up top, that line ends at 400%. So if your income is higher than these poverty levels, you're not going to be able to qualify for a credit when you had been for the last 5 or so years. So that could be significant to a lot of people. This is when it gets trued up on your tax return. If you got a advanced premium tax credit, you must file this form with your tax return. And the IRS has gotten wiser about this, because it used to be people didn't always connect the health insurance credit piece with your tax return. They thought it was two separate things. So sometimes if you get insurance through the marketplace, you'll get a form at the end of the year, the same time you're getting all your other 1099s and W-2s, that's a 1095A that shows what you had for health insurance premiums, what you may have received for a credit. And you need that to do your tax return. The information from that form ends up on this form 8962. And it used to be, if you got that form and you forgot about it, or now that form, I don't think they send it to people in the mail. I think you may have gotten an email, or you have to go online to get it. So it can easily be missed. But if you didn't take the information from that 1095A and fill out this form on your tax return, you could file your tax return and you'll get a letter from the IRS several months later asking, hey, we see you got a advanced premium tax credit, but there's no mention of it on your tax return. Now they're a little wiser to it, that if you got that form and don't do this form and you try to file your return electronically, the IRS will stop right there and kick it back and say, nope, we can't accept this because we see that you've gotten a premium tax credit and you didn't prepare this form. So that's kind of new. It's a little convenient that we can go back to people. Most of the time I go back to people and say, hey, did you do this? And they may have had health insurance for only a couple months and then maybe qualified for main care or something changed and they totally forgot that they had it. So we can go back and kind of catch those people at a time. Or sometimes it's, a significant, I didn't realize you had this. This could change things a lot, depending on, it could be good news, it could be bad news. But that's something that's changed in recent years. This just shows, I include in this slide, the credit is figured based on your modified adjusted gross income, which in most cases is basically just the adjusted gross income from your tax return. There are a couple other adjustments to it if you have tax exempt interest or a couple other things that most people don't have. But that's what's used to figure that credit. This is for 2025. I'm kind of personally on a little bit of a middle ground here because I'm still talking 2025 because that year just ended. I will be for the next several months doing tax returns and dealing with 2025 numbers. So I have a lot of times where I'm talking about this year and I mean last year, and people are talking about last year and they're talking about this year because I'm always a year behind, just the nature of my work. So I've got some stuff here that pertains to 225 if you are looking to the next tax return you'll be doing in a few months. And I've also got information on 26 so you can know what to expect if you're signing up for health insurance now. But it's stuff from a tax standpoint that won't affect you till your next year tax return a year from now. But this is the 2025 poverty lines based on what your family size is. This is what that calculation is, and those family size poverty line limits. And in 25 and before 25, but there were repayment caps in based on how far off you were from that poverty level. So as you can see, less than 200, that is the poverty level. So if you had if your income was twice the poverty limit, you would be capped in what you'd have to repay of your credit. So I've got some examples to show that, but this is the most you'd have to repay if you were at each of these levels of poverty compared to the federal poverty lines that I mentioned before. And there were caps on what you'd have to repay. So that kind of saved people. And sometimes that was the determinant that I would tell people that if they're on the fence and they knew that, geez, I might have to do this, that, the other, I'd say, well, if you've got the credit, even if you're off, if you're not off that much, you'll at least be capped and you'll get a good, you'll have a nice credit that you'll have all year long. You'll get some lower premiums and, you're not going to be that far off because maybe it can be easier to guess your income. If you and your spouse have just a regular salary or regular income that you can count on during the year, it may be easier to guess where you're going to come out in relation to the poverty level. If you're self-employed, that could be a lot harder. If you run into some unexpected income during the year, you win the lottery or something, you may not know where you're coming out. But these caps were helpful. But in 26 now, there aren't going to be any other repayment limitations. And if you're over the poverty line, you'd have to repay all the premium tax credit that you got back. So that can be significant. Here's an example. This is based on 2025 income. So a married taxpayer is a family size of 4, and their modified adjusted gross income is $70,000. The poverty line for family of 4 is $32,150. So they were over that by 218%. Based on what I was showing you before, they're between at least 200 but less than 300. They're married couples, so that 1950 cap applies. They would be capped at 1950 for repayment. When they trued up what their credit should have been on their tax return, they find that even though they received a $9,500 advance during the year, they should have only gotten $7,000. So they were over by $2,500. Because they're in that cap this year on their 2025 tax return, they'd have to repay $1,950 instead of the full $2,500. Same example this year, but at the end they'd have to repay the entire $2,500 instead of being capped at $1,950. Another example here is someone that's ineligible now, because if things stay like they are right now, and the expanded eligibility goes away, this is a family of 5 with a modified adjusted gross income of 142. Their poverty level for a family of 5 is 35,140. They are more than 4 times that 35,140. So that's over 400%. They would lose eligibility to get a premium tax credit for 2025. It's not always bad news. Here's an example of a married taxpayer has a family size of 4. The modified adjusted gross income is 25,000. The poverty line for a family of 4 is not 30,000. That's a typo. That's to see if you're paying attention. It's actually the 32,150 that I used in an earlier example. But either way, it doesn't matter for this example. It's 32,150, but they are under the threshold for repayment because their adjusted gross income is below what their poverty line is. So they got a credit of 9,500, but they were allowed to have 10,000. They ended up getting a refund of $500. We touched on health savings account a little bit earlier. I want to mention these because these are one of the best things that are going in the tax world right now, because you get a tax deduction when you put money in, and it's also tax beneficial to it when you take it out. And there's not a lot of things that are like that. You can use this account for qualified medical expenses. This is another thing, like the premium tax credits, that education has gotten a lot better over the years. It used to be when these first came out and banks would promote, hey, we've got health savings accounts. But the banks didn't really know, and the individuals didn't really know if they qualified for them, and they were just accounts you could open. And they go to the bank and say, hey, this sounds cool. I'd like to open one of these. And they'd get one, and they didn't know if they were eligible or not. But you must be enrolled in a high deductible health plan. And a lot of times people will say, well, my deductibles are pretty high. I think I qualify. But it's a very specific term. Hillary mentioned it some earlier, but you'll know if your plan is a qualified high deductible health plan, because they'll often promote that. There are certain criteria you need to meet to actually be a high deductible health plan. Contributions to an HSA, they're not subject to federal tax at the time of deposit, and they can roll forward from year to year. Things that exist in the past, like reimbursement accounts or other medical accounts, you'd have to use them or lose them by the end of the year. Not the case with HSAs. They're also not stuck with your employer. So even if you maybe have an HSA through work, you change your job, that's your account. You can take it with you. That's very beneficial to a lot of people. Something else about that I was going to say. Oh, even if you get it, so there's still a tax benefit. If you get it through work and you're contributing through work and you're like, oh, geez, well, I can't get a deduction on my tax return. That's okay, because it's coming out of your paycheck pre-tax as well. So if that's going through work, your W-2 is not going to include that in your taxable wages. And if it's not through work and you're paying for it out of pocket, you can take a deduction for that on your tax return up to the contribution limits. And those contribution limits are $4,300 for individual coverage and $8,550 for family coverage. And family coverage is basically you plus anybody else. So you got a kid or multiple kids or a spouse, then you can deduct that. And again, you get a deduction for that off your income, and the limits are higher if you're over 55. But you can take that money out as long as it's used for medical expenses. You can take it out, and it's tax-free when you take it out. So not a lot of things like that you can get benefits for on the front side and on the back side of it. So one other thing I wanted to mention. Oh, I think I skipped this slide. But the last thing I wanted to say is you can deduct what you pay for your premium tax credit, the premiums you're paying, and also if you do have to repay any credit, those count as health insurance paid during the year. If you're an individual, it may be tougher to get a benefit from that because it goes as an itemized deduction. And itemized deductions, there's a lot less people itemizing right now because back in the Tax Cuts and Jobs Act of 2018, I believe it was, they greatly expanded the standard deduction for people, which meant a lot less people were itemizing, which is a good thing. It's a bigger deduction off your income. But it meant that things like medical expenses and state and local income taxes and mortgage interest and those things weren't as commonly written off on your tax return as they were before. And with this one big beautiful bill that passed in the summer, it made that bigger standard deduction permanent, which is kind of funny because it's only as permanent as someone down the road decides to change it. But for now, it's permanent. So it's harder to get that, but if you're self-employed, you can get a deduction for your premiums paid and the credit you have to repay in that current year tax return as a deduction off your income that's not subject to those same itemized deduction limits. So that's something that can benefit people if you're self-employed. So that's kind of the real fun deep dive into the numbers piece of it. But I guess the biggest thing is, again, call. If you're not sure, if you've got a question, if you sign up for health insurance, many months ago and now, oh geez, my job just changed a lot. Let me see how that affects my health insurance. Or call your tax professional, whatever, and run through that. I do a lot of those scenarios where it's like, hey, where am I falling in that? And I'll mention the HSA again, and also things like traditional IRAs or things where HSAs and traditional IRAs, you can contribute to them up to the tax deadline of April 15th, which can really help out because I've seen situations back where people were over the limit for their income and they would have to repay some of their credit. But by making an IRA deduction or making an HSA deduction, it lowers their income enough where they don't have to repay, or they greatly reduce that repayment that they would otherwise have to make. I've seen situations where people may have been just over the threshold of having to repay the entire credit that was going to be, $10,000 or $11,000, and by contributing as little as like $300 to an IRA, their repayment, they fell into one of those caps. They only had to repay, a few thousand instead of 10 or 11,000. So be aware of those kind of things too. I mean, it's great to ask questions when you're dealing with any of this stuff because it is complicated. There's a lot to it, and there's a lot of great resources that can help out. So I strongly urge you to do that if you need to. So that's all I've got.
So I want to thank our three presenters today on this really important and timely topic. We do have this room and some time for some question and answers. If people would like to do that in this public forum, feel free to ask, but we're also happy to have you guys, if you have more specific questions that you'd rather just ask one-on-one, we can stick around for a little bit. So before I end the live stream, if there's any sort of public, more facing type of question or more comments. Seeing no questions, I want to thank you all for coming. Or do you? Yeah, sure. Well, thank you very much for your valuable insights. And if there's one thing you all can take away, hopefully, is you know now who to call or who to tell your friends, families, and others about these resources. So thank you very much for attending today.
So you really want to start looking before you call them. You want to look at that plan compared to it. You want to know your doctor
thank you one last time for all of your help. And thank you. Please enjoy the rest of the agricultural trade show today. Thank you.
Look busy. There's the boss.
Right.
Welcome, everybody. I think we will get rolling. It's 3 o'clock. My name's Craig Lapine. I am the Bureau Director at the Maine Bureau of Agriculture, Food, and Rural Resources. And there is a farmer who I owe a call to. Hello? Because a lot of people have been calling about this program. But we're going to be presenting on the Maine Natural Resource Disaster Relief Assistance Program. And with me is FSA's, excuse me, Amanda May, Chief of
Farm programs
Farm Programs
for the state of Maine.
For FSA, for the state of Maine. And I asked Amanda to do this presentation with me really for two reasons. One is because FSA has its own tools that may be useful to producers, and also the way that the USDA has set up the program that I'm going to be talking about is if there is an FSA tool that would have or could reimburse you, then you won't be eligible for the Maine program. And so I think it'll be helpful. I will describe what the state of Maine is in the process of standing up. But it may be helpful to understand what FSA has available, both because they have that available and also because if you could go there, then you're not going to be able to come to us as we understand it. So if we could go ahead to the next slide. So this is the Maine Natural Resources Disaster Relief Assistance Program, and it is a chunk of money that was in a federal allocation. Thank you. Got it. Okay. It was in an allocation that was in a federal budget that actually passed in December of 2024. So the federal money has been teed up for a while. It's taken. We still don't have it in the state of Maine, but it was passed in that budget. And what it covers is it will compensate eligible agriculture, aquaculture, or timber producers for necessary expenses related to crop, timber, and livestock losses, including on-farm infrastructure, as a consequence of any weather event in 2023 and 2024. What I'm going to try to do is use my 20 minutes or so to explain what kind of producers are eligible for this and what kind of losses might fall into this. One thing that I will note is, so there was a total of $220 million that was appropriated by Congress, and it was intended for the 5 New England states plus Alaska and Hawaii. And that was done, I would say, out of a recognition that agriculture in those states tends to look different from how it may look the larger scale commodity agriculture that happens in other places. And it's that other kind of agriculture that a lot of FSA programs are designed around, which is not to say that Maine producers don't access and don't get a lot of advantages from those programs. But there was a recognition that there can be a mismatch, and so Congress explicitly set aside these dollars for producers in those states, knowing that sometimes there isn't an FSA program that particularly meets their needs. After Congress allocated that money, USDA came to those 7 states and said, well, how much do you think your producers lost from weather events in those 2 years? Through a bunch of different modalities, including maybe calling some of you in this room, we tried to put a number on all of the losses that may have occurred in the state of Maine from weather events in 23 and 24, and we came up with a number of $98 million, which we went back to the USDA. Ultimately, we were awarded $60 million of the total $220 million pot. So I think Maine did pretty well. We didn't get 100% of what we estimate those losses to be, but if you think about that total pot for 7 states, I think our producers did pretty well. I want to start with this disclaimer, which is that everything I'm going to tell you is the best information that we have today. And that includes a call that we had with not the FSA folks that are in the room, but with FSA folks in DC on Monday. So we are making good strides toward having a signed contract with FSA, but that it doesn't exist yet. And so this is our best understanding today of who is eligible and what is eligible. And I just want to make a note that there is a possibility that could change as we move to where we are now to a final contract. Okay, so who is covered? If you are, farmer, aquaculturist, timber producer, logger who suffered an eligible loss, in livestock, timber rights, production. So, but let's just start with the first part of that. Agriculture, aquaculture, or timber producers. Those are the kinds of businesses, the kinds of people, the kinds of entities that are going to be eligible. What kinds of losses? If you lost crops, if you lost income because you lost crops, if you lost timber or you lost income because you lost timber, aquaculture loss, infrastructure loss, and then also bare ground practices. Those are the kinds of things that if you had expenses or losses in those categories, this program should be able to make a payment to you to help you recover some of that loss. I'm going to just go through the language that is in the current version of our contract with USDA. So, crop losses, eligible losses or crop losses, including losses incurred from a loss in crop quality, expenses incurred as a result of crop loss, and that could be lost income, as long as those expenses are not already covered by an existing USDA disaster program, which is why I really wanted Amanda to be here, and so we can help maybe tease out if you've got questions. Well, am I going to be able to come to you, state of Maine, for this money, or do I need to, or would I have needed to go to FSA? timber losses. Do we have loggers or folks that have woodlots with losses in the room? I recognize a couple of faces. They're mostly farmers, but I'm happy to delve into any of these categories. And, you know, as we know in Maine, most farmers have woodlots on their farms that are an important part of the revenue stream. But if you suffered timber losses, you can get reimbursed for those. There are some, you know, guidelines around how much woodland can you know, a minimum amount of woodland that you can have, a minimum amount of loss that you're estimating. This does include, you know, timber that was already harvested. It was maybe at a landing point, and then it lost value because of weather events. Someone couldn't get to it, what have you. So that is also included here. I don't know if we've got aquaculture producers in here, but those losses are also covered. And this is probably the biggest difference from, and maybe the place where a USDA program probably wouldn't be available to you, but is available through this. So this is the infrastructure piece. So the state of Maine's program will cover on-farm buildings as long as those buildings had or intended to have commodities or livestock in them. So, and this has been a long negotiation with the USDA, but storage buildings that didn't or wouldn't have had crops in them or animals are not going to be covered. But if it was, you know, if it would have had or did have a commodity or livestock present at the time of the weather event, then it can be covered. But as I said, ineligible buildings include but are not limited to equipment buildings, repair shops, movable equipment. Above ground irrigation, if you lost above ground irrigation in wind or other events, that can be covered. A lot of the pieces, you know, the well itself, pumps are not, but the irrigation pieces themselves are covered. Aquaculture, again, I'm not sure if we've got aquaculture folks in the room, but a lot of stuff associated with so the aquaculture products are covered or losses, and then a lot of the equipment. And this took a lot of conversation with USDA because they didn't really want to cover things that could move around, but almost by definition, everything associated with aquaculture can move around. And so it is slightly different from the agriculture definitions. Plastic culture, so if you do row crops, if you do low tunnels and high tunnels, that can be covered in this program if that got damaged in those events. Also, and we have heard from people who had washouts on their farms, especially if those washouts prevented you from getting to a crop or preventing you from doing some work in the fields that you needed to do. So roads, bridges, culverts that do provide access to farm production are eligible. Roads in timber stands are not covered, but Christmas trees are considered an agricultural crop, and so if that's what you're growing, even if it may look like a woodlot to the untrained eye, your roads on a Christmas tree farm are eligible. Yep. Yes. Yeah, so if you've lost income because that field became inaccessible because of this, then yes. That's our understanding. One thing I didn't do a sign-in sheet. And Lucas, I don't know if you could quickly maybe grab a piece of paper, do it. I would, one of the things that we have not yet done is worked out with USDA what are the methods we're going to use for calculating losses. And some of it's going to be based on income, some of it's going to be based on the value of the thing that was lost. We really want to come up with a methodology that returns the greatest value to our farmers and loggers and aquaculturists. So it might be helpful to have some voices in that conversation as we're working with an outside contractor, we're working with the USDA to understand what would a valuation methodology be that really, we're probably not going to get you to 100% of your loss. Just we know we thought we had 98 million and we only got 60, so right there we're starting with that. We may not be able to get to 100% of your loss, but we'd like to come up with a methodology that most closely reflects what you might have earned based on what was lost. And so having conversations with producers as we develop that methodology is going to be helpful. So if you wouldn't mind, if you wouldn't mind us reaching out in a month or so as we work through the math on this and want to add your name. Also, my email will be at the end of this. You can always just shoot me an email. It's just craig.lapine@maine.gov. So there were instances where people had to go out and do more work on their land because of what happened. And some of those practices, some of that activity will be covered under the banner Bare Ground Practices. So here's the part that I think people are very curious about, and I apologize. I have a lot of contingent language in here because we are, we're still in the midst of this. But what are the next steps, and what is our estimated timeline? We have selected a contractor who's done a lot of disaster recovery in a lot of U.S. states to help us stand up this program. We just selected this vendor last week, so we're still in state procurement. Always has an appeals period where the people that didn't get the contract have the opportunity to appeal our decision. So we're in that window now, so I can't tell you who they are, and we're not actually under contract, but we emerged from that appeals period on January 22nd, and we hope to get them under contract, as long as we don't get an appeal, on the 22nd, even if we can. We then need to work with that contractor and with USDA to get our work plan approved. We are going to be sprinting on that. And Jessica, sorry, I don't know if anything changed in our meeting yesterday. I don't know if you can hear me. But I've got up here that we're going to try to get our work plan to the USDA by March 1st. Does that, anything in yesterday's meeting change your idea on that? We're going to try to move as quickly as we can. Great. If we can do our work by March 1st, USDA is working with 7 states. Everybody is sort of on roughly a similar timeline, and they do have a lot of work to do in order to read everybody's plan and approve them. And there's, everybody is aware, I think, of the cuts at the federal level. They've got limited staff, but if we're going to get our work to them as soon as we can. They then have to approve it. If they do, our hope is that we can open up an application by June 1st. couple things I'll say. I know June 1st is a terrible time to be opening an application. And we also want to do this, we've been moving as quickly as the situation allows. So we don't want to not open it because it's a terrible time. So I think the way we will compensate for the fact that June 1st is a terrible time to open an application for farmers is to leave it open as long as we can. And perhaps make partial payments to folks who get their applications in, knowing that not everybody's going to be able to get their application in June or July or August. So one model that we're looking at is we leave the application open for 6 months, but we at least make an initial payment to everybody. We see how far into the $60 million that takes us, and then we can do a top-off payment once the application closes. That is one model that we are looking at. To compensate for the fact that people have been aware of this program for quite a while, we really want to do what we can to get this money into people's hands for losses that they now experienced 2 full years ago. So how do we do that and balance that with the realities of farming in a state with a very, very short growing season, and that, June is really go time?
What's an FSA? What's it stand for?
Sorry, the Farm Service Agency, so that's a branch of the USDA. And the Farm Service Agency is kind of the USDA's, that's where their disaster recovery programs live. I think that's true generally, not just most of them, all of them, I think, live in FSA.
Maybe not all USDA's disaster assistance programs, but a good chunk of them that pertain to farmers especially.
Yeah. So, and also this congressional appropriation. So we have FSA offices here in Maine, and then this congressional appropriation is also flowing through FSA in DC. So that's my piece. And I can take some questions now, and then I think there's going to be plenty of time also after Amanda talks about the FSA programs where we can both take questions. Yeah. Correct. I am not aware, other than, the drought, there were drought declarations.
We have long-term standing programs that we implement on an as-needed basis, and we are implementing drought assistance right now. As Farm Service Agency.
From this pot of money is just covering weather events in 23 and 24. If you are talking about drought, and I'm not sure if you are, the state does have a farmer drought, well, it's currently called in statute the Farmer Drought Relief Program. We're working to change that to the Farmer Drought Resilience Program, because when we had a drought this summer, people were calling us saying, can you do something quickly? And that's not really how that program is designed, but it can help you establish a well, a pond, some other sustainable water source. By the way, everybody in this room should know that application is open right now. So if you want, if you are looking for help with a well or a pond or some other sustainable water source, it won't help you with things that you lost in 2025, but it might give you the infrastructure you need to prevent future losses. So I don't know if that answered your question. And you had a question over here?
So if you, like we have, like with FSA, but some of them are not, like, they don't overlap. If you do go through the
Thanks a lot.
program, that's through FSA, are you then able to, anything that wasn't really covered there, or are you, or is it not eligible?
You can't be covered for the same loss. But if it is a different loss and it was not covered by an FSA program, my understanding is that would be eligible, but maybe this would be a good time to turn things over to Amanda.
I don't know what the rules pertain for your programming. However, I wonder, because some of our programs cover like 50% of a loss, can your program make them whole?
I think top-offs have been disallowed.
So I guess one of the things that it seemed that it looked like that what we did was infrastructure. So we had barn to get to store. That, we didn't have that through the disaster. We had, corn crops, acres and infrastructure. So I was just wondering, if you did go to the FSA, are you then just not allowed to print this one, or is it a different?
I think it has to be like, this is my guess, but duplicative of the actual loss. So if you got paid on a corn loss, then you wouldn't be able to apply for that piece of their program. But if it was something else, I think you'd be eligible. I don't think working with us is not going to exclude you from working with them.
I just didn't know if it was the same program that I used, but,
Another example, I'm just talking away now, but like,
Go
we
ahead.
did have the ability to, under our emergency conservation program, we provided cost share for debris cleanup. So if buildings were, like your hay building, that we had the option for you to apply, and we could have helped for the debris cleanup, but we couldn't help you rebuild that building. So I'm hoping with your program, if we cost shared for the debris cleanup portion, you can still provide a financial,
I think that's a great example. My understanding
Yeah,
is yes,
yes.
that, FSA was not gonna rebuild buildings. And I wasn't aware of the debris cleanup piece, so I think that would be a good example of, yep, they had a program, you could have accessed that, it wouldn't have disqualified you for what we can pay on.
as far as receipt or documentation, pictures or building costs, are any of those or is it more concrete?
That's why I wanted Lucas to get this. We now are in this phase with this contractor of figuring out what our methodology is. Obviously, we want to safeguard against, fraud and abuse. I don't think anybody in the room is gonna be doing that. So, but we also wanna make it as low barrier as possible. So that's why I'd love to hear from producers, like, what do you have? What would be easy for you to produce? There are, FSA does this all the time, and they've got certain kinds of methodologies, but a lot of that is around commodity pricing and what that lost value might have looked like. Because we've got this infrastructure piece, I think we want to know, like, if you went ahead and rebuilt the building, you probably have got documentation of what that cost you. Maybe you couldn't afford to rebuild everything, so maybe you want to do some kind of hybrid where this is what it costs us to rebuild, but we actually lost 1,000 square feet because we couldn't afford to build what we had before. So but we want to know what you've got, because that might help us determine our methodology, because we do want to figure out methods that get you as close as we can to the full value of the loss. Doesn't mean we're going to get to the full value. We're not going to be able to reimburse you for the full value, but at least we want to get the right number on what was lost, so that if we've got to ratchet that down to 35 or 65%, it's 65% of the real number. It's not already 65% of 50%, Well, I think the assumption here is that the building was damaged so that you could no longer use it for that. So it would have to be that sometime in the year beforehand, it was being used for livestock, or it was being used for crops. you lost access to that function. And so that's what you would be compensated for. Now, if you then, you really scrambled and hustled and you had the loss in December of '23, as a lot of people did, and by June you had a new building in place, then I think you just show us what it costs you to rebuild that building.
Like loss in value, for example, I happen to think right now is Warren, Blue Building, it has less value than even then, so one has contributed back there in various stages before, but it's now contributing to losses in the day, and of course, but the manhole is comfortable, you know, with the main.
Yeah.
So would, the plan was working effectively through there, 12 months and a half of the losses, that is something that you could potentially qualify for infrastructure.
I would think that you wouldn't need, if they were in there before, that's the only qualifier I think that you need. Again, like this is the hard task that's ahead of us. How are we gonna value that loss? And so, so it wasn't a total loss, but you lost some value in that building. It would be great to get to be able to repair that building, I would imagine, to get it back to where it was. And so how do we put a number on that to get you back to where you were?
Curious how you would justify a number better than, are there specific events that you have said that
No.
how do you?
No, if you can make a case, I mean, obviously Congress was thinking about specific things, but the language was generous enough, and USDA has told us you got these 2 calendar years, and if someone can make an argument that it was a weather-related loss, even if it wasn't what we were thinking about, then that's okay. But this did, people may recall, we had those crazy windstorms in December, and then in January, and then also that was the early frost. So a lot of fruit growers really got slammed. So there are lots of things that we could point to weather as losses. Why don't we let Amanda talk about her programs and then continue this back and forth. And so we need to switch over to the PDF
Yep.
version.
So I actually came prepared to just kind of talk about what we have for disaster assistance available right now, because I wanted to put a positive spin. I didn't want to say, okay, if you did this, you can't do this. I wanted to say, this is what we can do. This is what we can do for you. But I will skip ahead. I was going to cover drought first, but I will skip ahead so that we're talking about 23, 24 at the same time. That's it. Okay. This is it. So we are currently implementing a few programs. These were funded through the same source that provided the funding for the state grant program, and that was the American Relief Act. And we are currently accepting a sign-up for a couple of these programs. A couple of them have concluded, but I wanted to mention them just to kind of tell you what we offered for that year. The milk loss program, that is going to provide a financial incentive if you had to dump milk due to a storm in 23 or 24. That could be because of, you lost power, or your roads were blocked due to the storm. So if you were a dairy producer and had to dump milk, that would be a program that would be available to you. Another one is the On-Farm Stored Commodity Loss Program, OFSCLP. That is for if you have stored crops, commodities, whether it's something you harvested yourself or something you purchased, but it's used to feed your livestock, or you just have it in storage, stored grain that you intend to sell, for example. If you have a commodity that was in storage that you lost due to one of those, or due to a storm in 23 or 24, then we will provide you some financial reimbursement. Sign up for those programs ends January 23rd. So if that fits your need, then reach out to your county office. Does anybody not know where their farm service agency county office is, who your FSA representative is? You're all familiar with those offices?
Yeah, it sounds like, yeah.
You don't? Do you farm in Maine? Do you farm in Maine? What county are you in? Kennebec County? You have an office right here in Augusta. The county director is Maria Granger. Yeah, perfect. And I do have like some QR codes and links in my PowerPoint that you can use your camera to access that information with. And we do have a booth here also where we have a list of county offices. But we have representation. We have 13 county offices in Maine, representation for all 16 counties, basically. So these programs should be fairly easy to access. A couple other things we did for 23 and 24, we had the Emergency Livestock Relief Program for floods, and that provided, sign up for that just concluded in November. We're providing like financial money basically for anyone who had to purchase increased feed due to supplemental feed due to a flood basically. So really for that program we ended up with counties that were eligible, and you just had to provide documentation that you had livestock. And payments will be issued under that program in the very near future. We also had the Emergency Commodity Assistance Program, but that really wasn't disaster assistance. That was, we paid, basically if you reported an agricultural commodity on your acreage report in a county office, then we just issued you money. We cut a check. We do have disaster assistance programs that are, like they're always in place, and we would have offered those in 23 and 2024. I think our best way to handle that will be on, like, once the State Department of Agriculture has their rules in place, we can sit down and really determine what would be the conflicting purpose of that. Because some of our programs, producers may have received an incentive from, but I don't know that they'll be in direct conflict, and so I don't really want to go into those weeds and scare you for no reason. Some programs that I have in mind are our non-insurable crop disaster assistance program, where it works like crop insurance. You would sign up before the growing season for your commodity, for your crop, and catastrophic coverage covers a 50% loss, and then we would pay you 55% of the average market price for that. There are buy-up options also where we can cover at 5% increments up to 65%. Those come with a premium, and you would know if you had coverage because you have to opt in for it. Another one would be our tree assistance program, where if you have an orchard or Christmas tree farm, if you lost trees due to a weather event, then we will provide financial incentive for you to replant and rehabilitate trees. We have a livestock program that's similar. It's the livestock indemnity program, where if you lose livestock, and that's directly related to weather, then we will indemnify your loss. That one, the tree assistance program and livestock assistance program do not require any buy-in on your part. You just need to notify us of your loss within 30 calendar days of the loss becoming apparent. So anytime you have a loss on your farm, reach out to your local county office. Lucia, did you pass those around, or did you just bring some in? We've got extras. If you don't know your county office, grab it back there. If you have a loss, reach out to them, because chances are we have a program that might be able to help. If we don't have a program today, sometimes, quite often, we get ad hoc programs down the road that will help retroactively. Yeah.
What is the buy-in
For the catastrophic coverage, and if you're a female-owned organization, it's free. If you're not, then it's $325 a crop. up to, per crop, but it's capped, and it's like $8.25 per county, and then then we cap it at 3 counties. So yeah, that's the catastrophic level of coverage, and then there are buy-up options as well. It's catastrophic coverage is free for any historically underserved group, and that includes women, minorities, beginning farmers if you've been farming for 10 or fewer years, and then if you meet income parameters, we consider you limited resource, and you'd have to self-certify that. We have a tool where you could self-certify to that. So I think that covers what we did for 23 and 24. If anybody's interested, I also have information. I'll show you this first. So these are actual links. If you click on it, you can get to the website. I don't know if you can share this, make this available to, you have contact information for people here?
Yeah.
Maybe they can make this available, because this is a website that is specific, it's a USDA website specific to the 2023-24 disaster programs that both of us are talking about. And it's a page just geared towards those years, and you can learn everything you want to know about programs available for weather events for those years. And then the rest of the disaster assistance things we have to offer are linked at the bottom. And if you have your phone and you want to access some of those things now, I do have a QR code in it that you can. And then, is anybody interested in what we're doing now for drought? Because I will.
Yes.
Okay, great. Back to the beginning. The first thing I probably should have told you is the Farm Service Agency, there's 2 sides to our house. One is programs, which disaster assistance typically falls on the program side, and then we do offer farm loans as well. I'm not going to delve deep into farm loans, but I do mention them a little bit in my presentation. And here's a good resource as well, farmers.gov/recover. There's a good tool on that site where it's a disaster discovery tool where you can punch in some information pertinent to your disaster, and it will list all the resources that the USDA has available to you. Because we do have sister agencies, and they do offer some disaster assistance types of things as well. So for the drought, we are currently accepting sign-up for the livestock forage disaster program. That isn't available in all our counties. It is available in counties that either hit D3 on the drought monitor or D2 for 8 consecutive weeks during our grazing period, because this is specific to grazed animals. And what this program does is it will provide financial, not reimbursement, not incentive, I'm struggling with the word there, but it'll provide you some dollars to help you assist with increased feed costs that you incurred due to drought grazing losses. So your grazed animals, the grass wasn't feeding your animals as much as it should have. You probably had to purchase feed. This program is intended to provide some financial stability through that.
Do you know off the top of your head which counties? Because also FSA often has a rule where it could be your county or it could be an adjacent county where there's a declaration. And I was under the impression that between those two things, much of the state actually was kind of swept up in
So
it.
we do have a secretarial disaster declaration that encompasses the whole state, but this is specific to the grazing time frame, and contiguous counties are not included. So
Gotcha.
I do have the list of counties here. It would be Androscoggin, Cumberland, Franklin, Hancock, Kennebec, Knox, Lincoln, Oxford, Penobscot, Saginaw, Somerset, Waldo, Washington, and York. That's for this year. This is in response to the drought. And depending on, like, how the drought conditions stay, like, it could be pertinent to next year also, depending on if we recover from the drought or not. It's, much of the state is still in D2 or higher drought. So,
This is the program that's available right now.
yep, everything I'm talking about right now is available right now in response to the drought. I mentioned our non-insurable crop disaster assistance program. That one covers pretty much anything that isn't covered by crop insurance. You can get coverage for under NAB. So your hay crops, aquaculture, Christmas trees, fruits and vegetables, except for, you know, like you can't get coverage for your blueberries in Washington County because that's covered by crop insurance. Similarly, you can get potatoes in some coverage for potatoes in some counties, but not like Aroostook County because crop insurance is available. And your county office will know if the crop is eligible for coverage or not. Catastrophic coverage is free for those historically underserved groups that I mentioned. Otherwise, there is a service fee of $325 per crop. And the catastrophic level covers losses above 50%. We're going to pay you 55% of the average market price. And buy-up options are available. If you buy up, you will be charged a premium. Premiums are halved if you're a member of a historically underserved group. But your coverage level is higher, and we're going to pay you 100% of the average market price if you have a loss.
Oh, I thought you had said the buy-up was only up to like
65%.
65%,
Yep.
but then
So-
you pay out 100?
100% of price.
The value, yeah.
Yep, so CAT coverage covers 50% of your normal production, but we pay it 55% of the price because it's CAT coverage. And then, yeah, the buy-up coverage, we're paying at that higher rate, which does make it beneficial, especially if, you know, the service fee is waived and your premium is reduced. So the Emergency Conservation Program, we are offering that right now. Sign up technically ended for that December 31st, but our county offices have the ability to, like, they have some leniency in taking late filed applications for that program. That program it does a lot of things, but in response to drought, it provides emergency water for livestock and orchards. So if your well was low, dry, and you're not able to meet the needs of your cattle or your orchard, then we say it's cost share to drill a new well, provide a new pump, run piping to supply water for your livestock or your orchard. I say cost share. In the past, we cost shared 75% of your actual expense. However, now it's a flat rate. So when you sign the cost share agreement, that dollar amount is what you'll receive once you complete the practice. So you know in advance what you'll be getting. And if you can, you know, contract with someone to do it a little less expensive than what we're cost sharing, then you could walk away with a little money in your pocket. Stop me at any time with questions. Yeah.
I can see a cash share program, so you would have to demonstrate the losses from the prior period to show the need for the second period as well.
You had to have, so if we're gonna, it's a program that repairs damage basically. So if you're gonna ask for a well to service your cows, you had to have a water source in place for your cows before the disaster. Yep. And so, our sister agency, the Natural Resource Conservation Service, they're our technical service provider for that program. We do all the administrative things. They'll go out on your farm, they'll send an engineer out, and they'll, you know, determine that you need additional water, and they'll create a plan for you to follow. We'll provide a cost share agreement. You'll sign agreeing to that. You'll implement the practice, and NRCS will go back out and say, yep, you know, this is is serving the intended purpose, it meets our design standards and specifications, and then you'll request your cost share and we'll issue a payment. That's how it works. Sometimes that initial, like, realizing it's cost share and we don't pay you until after the practice is installed, sometimes that can be an issue. But
Just want to do a quick time check. We got about 12 minutes left, so I want to make sure you cover what you would like to cover and then also continue to field questions.
The tree assistance program, I mentioned that is a program where if you lose trees, like that are in orchard or Christmas trees, then we can cost share to replace and rehabilitate. ELAP, the Emergency Livestock Assistance Program, that is an umbrella program that covers a lot of different things. Specific to drought, we are going to provide like a financial incentive cost share if you had to haul water to your livestock, specifically grazed livestock, but really you only need to show that you have grazed animals to be eligible for it. So we'll provide reimbursement, I guess, for increased costs associated with hauling water and hauling additional feed to your livestock as a result of the drought. As we mentioned before, all of our counties are encompassed by a secretarial disaster designation. That designation opens emergency loan funds. So producers in every county in the state are currently eligible for emergency loan funds. I'm not a loan officer, I'm a program person. If you have loan questions, I do have Kim Beely with me and she can answer emergency loan questions. There's that disaster assistance discovery tool. And then we have one for farm loan discovery tool, if you want to explore our loan options. And I mentioned we do have service centers all through the state, 13 of them. And that QR code takes you to the service center locator. As of yesterday, that website wasn't working. The software it feeds from was down, but it might be back up and running. And Lucia did bring in the listing of all of our offices. And then this QR code takes you to our Gov Delivery sign up. We issue monthly bulletins just telling you these are the programs that we have available right now. Keeps you in the loop. And we don't bombard you with many emails. It's just basically a monthly bulletin, and then we'll send out a press release, a news release, whenever something's hot off the presses.
I can vouch for that. My family's got a small farm in Pownell, which is in Cumberland County, and I am on the Gov Delivery. You know, we've been to that office in Scarborough many times to explore programs. Anyway, you do not get bombarded, but very, very helpful information that comes out. I think I got one today.
Irrigation program rolls out in the
So it's specific to orchards, and the deadline was December 31st.
That's the state program, and that is open right now. It's open now, and I think, thank you. I was going to go to the website, February 23rd, thank you. And as long as I'm plugging some of our programs too, we expect to open next week the second round of our Maine Healthy Soils program, which modeled very much on kind of an NRCS program where it will pay for healthy soils practices, which also can make you more drought resilient and more, erosion resistant and those sorts of things. So, drought relief is open now. Healthy soils will be open in about 2 weeks, and that will stay open probably for 6 weeks. So if you want to do things like plant cover crops or mulch or do other things that increase your soil health, which has a very strong crossover with drought resilience as well. If you are already doing those practices, or if you would like to adopt them, then we can help share the costs of adopting those practices. One little caveat is that you do need to have a healthy soil plan, which we can help you write, which the soil and water districts, we have contracts with all the soil and water districts, so you do need a healthy soils plan in order to get, and the same is true actually with the drought relief. You need to have a water management plan in order to get approved for a well. Those can be done simultaneously, or they can be done sequentially. You get the plan first, and then you come back and you ask for the implementation part. Although in the last round we did them simultaneously. You could get a plan and get your water source approved.
Yeah.
We probably have time for maybe 1 or 2 more questions. And also, this is my last session of the day, so I'm happy to hang out and continue to chat if people have questions. I don't know if there's something else in this room, so we might need to go to the hallway, but happy to chat. Yeah, Chuck. The debris.
Yes. Our emergency conservation program, in response to the storms in 23 and 24, we did take sign up for debris cleanup. And if you had a building blown over, then we would consider that debris cleanup, and that would have been eligible. Yeah. Sadly, that sign-up window is well in our rear view mirror, and we're kind of tying up the loose ends from that program, making final payments under it. But if it happens again, it would be definitely something you, yeah. Yeah.
You mentioned the frost damage to the orchard. I'm assuming 2023 I had failure because of frost activity. And the failure, no none at all. My trees were damaged, so it takes me back to the year for it. I'm assuming that that's what you're talking about, just 1 year of problem.
Yes, so, so in that instance, I think we'd want to look at income records and see, what did your crop earn in '22, and compare that to 23 to make the case that, you know, that was a total loss, yeah.
You're both from the state, but for a US,
She's with USDA, I'm with the state.
you know,
There is one in Augusta, and the address would be right on that pink sheet that Kim's gonna bring to you.
you're with the state now.
Yeah.
And this drilling program for drought for 2025.
You don't, it's to create a water source on your farm. So you don't have to have necessarily experienced a loss. It's just, do you need to develop, you know, are you at risk of drought damage, and therefore do you need to develop a new sustainable water source? So that's what it will pay for.
Because we're still in drought,
Yeah,
and what they're projecting is we're gonna continue with the drought this year, and I, for one, I've already made an application, but I'm not quite
Great.
sure of what they're looking for with all that application, but it's for a well to be drilled to, cover possibilities for this coming year.
Did you, and we have a program where if you had irrigation in place and a viable water source before the drought, then we can cost share to drill you a well now. But you just, the difference is that he's gonna create a viable water source. For our program, you had to have one that was, and it's no longer an option because of the drought, basically.
I have one in the past, but we used the USDA to help develop a plan. But the well I was working with was insufficient,
Yep.
and we couldn't work out for that reason.
but you also do cost share on drilling wells.
That's what we're saying,
Oh.
and so you would be eligible to apply with the Farm Service Agency. And like I mentioned before, our cost share rates used to be 75% of your own expense, now it's a flat rate. So if you went in and applied, we would send someone out just to verify, oh yeah, he has irrigation in place, he had a source before, it's not servicing his needs now, we can drill him a new well, provide a new pump, provide new pipeline. It would be worth looking into, for sure.
When you say a flat rate, I'm just wondering, the distances are involved, which means electricity, like from a distant pole or something like that, perhaps a new pole, all that kind of stuff is involved.
Electricity, no, I don't believe so, but we can do a solar powered pump. So,
I have, and the well was not sufficient even for the solar pump.
okay, yeah. You must have worked with NRCS. The Natural Resource Conservation Service, NRCS, they're the ones that would work with you to design what you need.
They did the design on the irrigation system.
Yeah,
Unfortunately, the whole plan.
hasn't met your needs.
It required a certain, it was designed around a low-producing well to start off with, but now we're going to try to maximize the use of that low-producing well, and it uses even less than it's supposed to.
Right.
But of course, it's drought here.
Right. It sounds like you'd be a perfect fit for our program, so I would encourage you to talk to your office.
What county are you in? Okay.
Kennebec, yeah.
So we are out of time. Thank you so much, and thanks for everything that you do every day as farmers and other producers. And again, I'm Craig Lapine. I'm happy to hang out. It looks like maybe there's not a session in here right now, so I'll just be available if people want to chat. And thank you, Amanda, very much for doing this session with me.
And I'll be available if people have questions also.
Thank you.